In this video, we're going to go through setting up an arterial line to achieve bedside monitoring of intravascular pressure, as well as go over important considerations for using the device correctly. You're going to need the TrueWave Vamp Plus kit, which includes a transducer, the Vamp Plus 12cc syringe, and its specialized tubing that has 2 sampling sites for obtaining blood. Also, a 500 milliliter normal saline bag, appropriately sized pressure bag, a true clip holder to attach to the IV pole, and appropriate cable to connect the bedside patient monitor to the end of the transducer. Connect the true clip holder on the IV pole near the patient's monitor if possible. Next, mount the transducer, the syringe, and the proximal sampling port to the true clip holder. Next, you'll need to de-air the IV bag and prime the TrueWave system. Spike the IV bag with the fluid administration set. Open the roller clamp on the IV set. Open the vent port by turning the stopcock toward the patient's pressure tubing. While keeping the IV bag inverted, gently squeeze air out of the bag while pulling the snap tab flush device until air is removed from the IV bag and drip chamber is filled about halfway. Next, insert the IV bag into a pressure bag and hang it on an IV pole about 2 feet above the patient. Confirm the IV bag is securely hung on the IV pole. Next, prime the TrueWave system to gravity. Do this by pulling on the snap tab flush device to deliver the flush solution through the TrueWave transducer and out through the vent port's vented cap. Remove all air bubbles. Close the vent port by turning the stopcock toward the cap. Push the reservoir plunger to the closed and locked position until you hear the audible click. Holding the pressure tubing in an upright 45-degree angle, pull the snap tab to flush the remaining part of the line through the end of the tubing. Visually inspect the line to ensure all bubbles are removed. Next, pressurize the IV bag to 300 millimeters of mercury. Turn the stopcock toward the pressure bag to lock off the air pressure. Make sure you're intermittently assessing the pressure during use, as pressure decreases as fluid leaves the bag. Low pressures in IV flush bags can lead to dampened waveforms and incorrect readings. Pull the snap tab to flush the system under pressure while tapping on the tubing and stopcocks to remove any residual bubbles. Replace all the opaque vented caps on the side ports of the system's stopcocks with non-vented caps. Use the appropriate connection cable to connect the patient's bedside monitor to the TrueWave's white cable. For intravascular monitoring, level the transducer to the patient's phlebostatic axis, which is found at the midpoint of anterior and posterior chest wall at 4th intercostal space. It's important to maintain the level of the transducer with the phlebostatic axis at all times while monitoring to ensure accurate pressure readings. Zero the transducer to remove effects of atmospheric pressure. Open the stopcock above the transducer to atmospheric air by turning the stopcock towards the patient's pressure tubing and away from the TrueWave transducer. Remove the non-vented cap, select the zero function on the bedside monitor, and confirm that the monitor's pressure channel waveform and numeric value display 0. Check monitor calibration using the procedure recommended by the monitor manufacturer. Close stopcock on the transducer toward the vent port, then return the non-vented cap. If not connected already, connect the TrueWave tubing to the patient's catheter. Confirm the appropriate pressure waveform and numeric values are present. Perform a square wave test to assess the frequency response of the system by pulling the snap tab and releasing quickly. Confirm the pressure channel has the appropriate label, scale, alarm settings, and color coding for the physiologic pressure being measured. For blood sampling, you may need to obtain a direct draw unit, blood transfer unit, and collection tube syringes, as well as alcohol preps and a needleless cannula. Release the plunger latch and smoothly draw back on the reservoir plunger until the plunger stops at its 12 cc volume capacity at the recommended draw rate of 1 second per 1 cc. Close shutoff valve by turning the handle perpendicular to the tubing. Swab with alcohol per policy. Choose the swab sample site for your application and push the cannula of the direct draw unit into the sampling site. When blood has been drawn, remove the vacuum tube first, and then grasp the direct unit by the cannula and pull straight out. Next, you will need to reinfuse the clearing volume. Open the shutoff valve by turning the handle parallel to the tubing. Then, reinfuse, clearing the volume at 1 cc per 1 second until you hear the audible click from the plunger. Then, flush the vamp closed system by pulling the flush device on the transducer and then swab the sample site per policy.